Hello, my name is Azucena Leal, and this is my mock interview for the MSN Capstone class. Question number 1 is, what are your short and long range goals, and how do you expect to achieve them? Well, my short-term goals are to finish the classes I require, to be able to request testing for the boards. I intend to pass my boards on the first try, make a smooth transition into the FMP role. I've been a bedside nurse for so long that it is intimidating to step into this new area, get new responsibilities, new tasks. It is definitely a change, but I am excited to build on my experience and grow as a provider. Long term, I want to always continue learning, stay humble, and realize that the healthcare field is an ever growing field and we will never be know all kind of person. So we always have to go back and read more, study more, stay up to date in current practices. Down the road, I eventually plan to go back for my DMP when I feel ready to take that next step. Question number 2 is, what motivates you? First and foremost, my family is my greatest motivator. My daughters, my family, my parents, my partner. I want to make a positive impact in their lives, but also in the community I will serve. I always found it very rewarding when families and patients feel confident in their care, they feel informed, they make healthy decisions in their care because they are aware of the benefits, the risks, the consequences of their actions, and they know about their treatments. And I want to be the provider to educate them and to guide them through their health journey. I also want to continue my advancement in my career and provide for my family, provide for my daughters. Question number 3 is, what does patient-centered care mean to you? To me, patient-centered care means to acknowledge my patient as the center of the team. Everything that we do is to improve their health status. If we continue to make decisions for them and they don't feel like they're an active part of this team, they will continue to do the actions that got them sick in the first place, for example. To me, patient-centered care means listening to my patient, listening to my patient's family, include their values, their beliefs, their personal choices, and understand their options. I think that listening, clear communication, and involving everybody in their decisions is key to building trust and to helping them get the better outcomes. According to the National Academies of Sciences, effective communication and patient-centered care are essential components of high-quality healthcare and improved outcomes, particularly in advanced practice nursing roles. Question number 4 is, how do you interact with patients and their families? I try to create a safe space. I allow them to ask questions. There are no silly questions. There are no judgment zones. When they enter that comfortable and respected zone, I listen, I ask all the questions, I allow them to answer, I encourage them to share their concerns, their goals, their feelings, their fears, and then make it a point to explain things in simple terms, and then check for understanding. Sometimes people can be embarrassed about not understanding something and they just go with it and have no idea what's going on in their care. So I feel like informing them and involving them in their care is the best approach rather than feeling overwhelmed or left out. Question number 5 is, tell me about your greatest achievement and greatest disappointment. Well, my greatest achievement is to be here today answering these questions. 2.5 or so years ago, I enrolled in school. I had no idea what was going to happen. I had no idea if I would pass. I had no idea if I would like it. I didn't know if I was cut for it. And honestly, sometimes I felt a little discouraged. But Today, as I'm preparing for my first job as a nurse practitioner, I feel like it is the greatest achievement of them all. Along the way of balancing school, jobs, working overtime, my personal life, my kids, my family, I really had to strengthen my time management skills and really build resilience and commitment. One of my greatest disappointments was that when I first enrolled into school, I thought I wanted to get it over with, go all the way to the DMP program. But as the degree kept advancing, I just felt like I needed to take a step back and take a break after the master's. I realized that I need more time to focus on passing my boards and step my foot into the NP program first before going to the next step. At first, I was feeling a little down about myself, but I reminded myself that it's okay to take a break and it's okay to know our limits. But I'm confident I will go back one day when I'm ready. Number 6. Tell me about the best and the worst bosses you've ever had. So, the best boss I've ever had is actually my current manager where I work right now in a pediatric emergency department. He is very supportive, he's very kind, he's genuine about caring about his employees. He cares about the patients. Sometimes when we're short staffed or there's a big trauma coming in or multiple things are happening at once, he's not afraid of coming out of the office and just be back to bedside nursing. He takes the time to train nurses into ultrasound guided IVs, which I've been on the newest team, and I am very grateful for that. He is very respectful, inclusive of patients' preferences. He is very skilled, and every time I have a concern, he listens to me. He gives me positive feedback. He checks in often. He truly leads by example, and I really aspire to be like him someday. On the other hand, back when I was a new nurse, I had the most challenging bosses. She created a very stressful, unsupportive environment. There was little transparency, unsafe staffing, and sometimes the staff felt intimidated, singled out, and unsupported. At the time, since I was a new nurse in the States, I accepted it as the norm, and I felt like that was just how nursing was in the States. Moving on to a new role later down the road, I realized how unsustainable those conditions were. And the experience bit there taught me really how to swim, not sink, keep going. It really taught me the need for strong, supportive leadership and advocating for safe patient care and creating a team environment where staff feel respected and valued. Overall, having both experiences really shaped the type of colleague I want to be and the leader I aspire to be. Someone who supports the team, prioritizes patient safety, and leads by example. Question number 7. How do you handle stress? Well, I handle stress by staying organized, prioritizing my tasks. I keep a healthy work-life balance. I make sure to communicate with my colleagues, reflect on what's working, and take care of myself to things like mindfulness, knowing my limits, and set boundaries between work and home. I speak up when I feel like something is not working, and this allows me to be able to clear my mind, get the answers I need. If I ever doubt something, I stop, research, and come to a conclusion. Above all, I remind myself that I am human and it's okay to take a moment to breathe. Number 8. What are you looking for in this job? I am looking for a position where I can grow as a new NP, somewhere that will take the time to train me, teach me, support me as I step into a new role. This is all a new ground for me. As much experience as I have as a bedside nurse in different specialties, this is a complete new game field for me. I want to be able to ask a question, have my team members be patient, collaborative, welcoming. I want to feel safe to ask questions and be part of a team where everybody supports each other. I also want to be part of a workplace that prioritizes patient centered care and safe decisions for the community. I also want to be part of a group that supports learning and professional growth. Number 9. What constructive criticism have you received from employers? I can think of maybe the feedback that I've received in the past about not being on time to work, and I really took that very seriously. Since then, I've put systems into place, being more responsible, better planning, and time managed better. It hasn't been an issue at all since then, and having that feedback helped me become more accountable and reliable. And now I'm sure that I have to be on time and prepared every time I show up to work. Number 10. Why do you want to become an FNP? I wanted to become a nurse practitioner to continue advancing my career, and I want to keep climbing the nursing ladder. There are many possibilities in the nursing field and different specialties, different roles, and to me, FNP just called me. So I wanted to make a positive impact in my community. I love the idea of providing holistic care to my patients, their families. I want to feel the sense of autonomy and to keep learning, trying new things, taking on new challenges. I've always liked exploring new things. I've always switched specialties: ER, pediatrics, ICU, medical, surgical. I've always loved to learn and see what else is out there. When I joined the nursing field, I knew I wasn't going to be married to one specialty. I wanted to learn more and see which one's my favorite. So becoming an FMP felt like the perfect next step for me. And well, here I am now. Thank you for your time.